So thank you very much for joining us for this COVID-19 employment law Q&A session. My name is Carissa Miller. I am the Program and Communication Specialist for Montgomery County Medical Society. A few housekeeping items before we begin today. We have muted all participants upon joining this call for sound quality purposes. To mute or unmute yourself during this call, press *6 on your phone. Or if you're on PC, you can hit Alt-A, or on your Mac, you can hit Shift-Command-A, or you can just type your questions into the chat box. We do welcome your questions. How the Q&A portion of this call will be conducted is we will begin with all questions in the chat box first, and then we'll move over to folks who would like to ask their questions via audio. About this session, in today's rapidly changing social and legal environment in response to COVID-19, physicians in particular are facing a number of complicated and difficult decisions about their businesses and in particular their employees. So we're very fortunate to be joined today by David Shapiro and Jim Hammerschmidt of the law firm Paley Rothman, which is based in Bethesda. Jim and David have years of experience working with healthcare practices and physicians and employers in general, so they can provide a summary of new and existing laws impacting Montgomery County-based employers as we all try to navigate a new world dealing with COVID-19 related laws and business issues, and then we'll proceed to the Q&A portion after their brief presentation. So thank you for joining us, and thank you to Jim and David. And I'll go ahead and turn this over to them at this point.
All right. Bear with me. Let me see if I can get the presentation up here. All right.
Okay, great. We can see it.
Terrific. All right. That's all we've got for today, folks. We'll deem that to be a success. So thanks everybody for joining us. We wanted to try to condense as much as we can. Jim and I are going to try to provide approximately a week to 10 days of incredibly rapidly changing information into a brief summary of where the law stands. And I will clarify that this may be where the law stood as of 11 o'clock this morning. As many of you may have seen, Governor Hogan did come on this morning and instill, as of tonight, a closure for non-essential businesses in Maryland as of 5 o'clock this evening. Don't freak out. Healthcare is one of those essential businesses. What we will try to figure out very shortly is which of the providers that are here are going to fall into the category of essential versus non-essential. So stay tuned for that. What we otherwise will do is Jim and I are going to try to go through a quick summary of where the law stands today, understanding that this may change before the end of the day with what's going on in Congress and state by state. And then we're going to try to run through a few of the very, very common questions that we're getting, and then we'll try to open it up to all the questions that you may have that we didn't address. So Jim, why don't I turn it over to you?
Yeah, thank you, David. Great introduction. As David said, things are moving rapidly. And as businesses and employers, we have a lot of decisions to make. Obviously, employment issues are a big one, but we understand there are many, many other things going on. So what's happening around us legislatively that impacts our decision-making process? First, last week, Congress passed the Federal Families First Coronavirus Response Act, which provides some new leave laws that have to be taken into account. Currently, there's legislation pending called the CARES Act, the Federal Coronavirus Aid, Relief, and Economic Security Act, which could provide additional relief for employers who continue to employ their employees throughout these difficult economic times. Maryland itself has passed some legislation that impacts employers. DC has passed some legislation, and then all three jurisdictions in the DMV have made adjustments to their unemployment insurance laws that make unemployment insurance and wage replacement more accessible to employees that have had their hours reduced, substantially reduced, or have been laid off. So why don't we start real quickly and dive into the two pieces of the Federal Families First Coronavirus Response Act that impact us the most. The first thing that is critically important to understand is at this juncture, these two leave laws, which provide some relief under limited circumstances for employees, do not become effective until April 2nd. So from now until April 2nd, employers have a bit more flexibility than they will come April 2nd if one of the eligibility criteria under these statutes are met for a particular employee. And under the Federal Families First Coronavirus Response Act, these laws will be in effect until the end of this year. So why don't we talk about the Emergency Family and Medical Leave Expansion Act first. First of all, the biggest thing to understand about this is that it's really pretty limited in scope in terms of who it applies to. It's broad in terms of what employers are covered under, because it covers employers with 500 or fewer employees, and as we know, some 65 to 70% of all businesses in the United States are small businesses. So it brings all of those within its umbrella. And a lot of what's interesting is a lot of those companies have not had to deal with the Family Medical Leave Act, because the Family Medical Leave Act only applies to employers with 50 or more employees in a 75-mile radius. So many small businesses have no experience whatsoever in terms of complying with the Family Medical Leave Act and the various parts of that statute. Now they will within a fairly limited scope. So first of all, in order for an employee to be able to take advantage of this leave, the employee has to be employed for at least 30 days prior to seeking family medical leave. And as I said, it's very limited. It only provides relief to employees who cannot work or telework because the school, their children's school has been closed, or their kids' daycare has been closed. That's it. That's the only employees who get to take advantage of this Emergency Family and Medical Leave Expansion Act. If they are able to take advantage of it, if you have an employee who come April 2nd or thereafter says, I cannot work or telework because my children's school has been closed or their daycare provider has been closed, and given Governor Hogan's order that came out this morning, don't know what's going to be essential business and what isn't, but if daycare providers are not considered to be essential businesses, then they will be closed. And if that's the case, then under this act, the employee is entitled to 12 weeks of paid leave. The first 10 days are unpaid, and David's going to talk about some of the options there, but the first 10 days are unpaid. And after that, the employee is entitled to take leave for up to the 10 remaining weeks at 2/3 of the regular rate of pay, which is capped at $200 per day or $10,000 per employee in the aggregate. There are going to be some exceptions or some possible outs for employers with 50 or fewer employees. There is going to be possible exemption where paying those employees for the family medical leave over that 10-week period of time jeopardizes the viability of the business as an ongoing concern. That's probably going to be a significant number of companies. The Department of Labor is going to be fleshing that out with some regulations. We don't know what that's going to look like exactly. We don't know what the criteria are. We don't know how an employer is going to be able to apply for that exemption, but all of that should be coming out within this week. Under the Family Medical Leave Act, employees are entitled to reinstatement to the same or similar job. That requirement is also being relaxed for companies with 25 or fewer employees, and if the position no longer exists due to the economic conditions or the operational changes that are made because of the COVID-19 public health emergency, and then the employee is not going to be entitled to reinstatement. Again, that's going to be essentially a small employer exemption. Don't really understand what choices a larger employer is going to have if a business of 25 or more employees is going to be out of business or ceasing operations due to this public health emergency. Obviously, there's no job that's going to be there to be reinstated to. So, but frankly, I think this is a little bit of a distinction without a difference at the end of the day. But those are the legislative exemptions that are being built into this legislation.
Great, thanks, Jim. With respect to the impact that the new federal law is having on paid sick leave, fortunately, I think, for most of us in Montgomery County, we're now aware that paid sick leave is a thing and it does exist. So the new federal law, again, is covering employers that have fewer than 500 employees. One of the differences, however, is that employees are covered from the first day of hire. So if you have individuals working for you, they are now going to be entitled to 80 hours of paid sick leave if they go out for a qualifying reason related to COVID-19. The qualifying reasons are essentially self-quarantine on the advice of a healthcare provider, diagnosis of COVID-19, and therefore they're out seeking care for that, compliance with an order to stay away from work due to the employee's exposure to COVID-19 or symptoms from COVID-19, to care for a family member who's self-isolating or has COVID-19, and similar to what Jim was speaking about, for a child whose school or daycare has been closed. There are caps put in place here as well for the first three items, and let's jump back to the slide so you can see which ones they are. That's the self-quarantine, the being diagnosis, or compliance to stay away or care for COVID-19. Those items are going to be capped, the pay on those items will be capped at $511 a day, and that's going to be maxed out at $5,110 per employee. For the last two bullet points, and again, we'll jump back so you can see them, that's to care for a family member who is self-isolating or for childcare purposes. Those individuals we capped out at $200 per day or $2,000 per employee. Much like Jim said with respect to the FMLA component of the law, is that employers who have fewer than 50 employees are going to, it looks like they're going to be able to apply for an exemption. There has to be a reason for the exemption. Generally speaking, it is going to be because of financial reasons, that paying these amounts jeopardizes the viability of the business. And as Jim said, we're still waiting from guidance from, I believe it's Secretary of Labor, as to how you're going to qualify for this exemption. So stay tuned for that. There's no notice procedure for this. So if an employee is sick, they can go out immediately. They don't have to provide any amount of time of work. If they've been working for you for 3 days and they're advised to stay home by a healthcare provider, this leave would kick in. So there is an exemption for healthcare workers. Now this is still a little unclear at this juncture. Right now, what we are seeing is that the exemption is deemed to exclude only those who are in critical service areas. So this is primarily people working in hospitals, working in emergency clinics. So for your typical medical practice, what we understand, the majority of people who would either be participating in the call today or that are active with the Montgomery County Medical Society, the typical employer, this exclusion, this healthcare worker exclusion's not going to come into effect unless you are in one of these emergency service categories. Otherwise, the one takeaway, which is something that we've fielded a lot of questions on, is workers are not covered if they refuse to work for fear of exposure. This is obviously very common. Workers who are out but they're not exposed, they're not sick, they're not caring for a family member or for a child who's out of daycare, then those individuals are not covered. Under this component, under the sick leave component of the federal law, this is really intended to cover people who are out because of one of the qualifying COVID-19 issues that you saw in the slides above.
Right. So the way, thank you, David. It's important to really understand that is it's actually probably at this point, with the exception of the child care coverage, it's probably a limited number of people that are going to be able to apply for paid sick leave. But if you have employees that are able to take advantage of this leave, the biggest question is, well, how the heck is it going to be paid for? And the structure under the Families First Act is that employers will receive essentially a dollar for dollar credit against their payroll taxes that are applied for on a quarterly basis in order to pay for this. In other words, what will happen is that, Dave, why don't you go to the next slide?
Sorry about that.
Yeah, that's okay. So as an employer, obviously you pay your quarterly payroll taxes. When that kind of time comes, you will want to, as individual employees take this leave, you will want to make sure you track it. You will want to make sure you track how much that's being paid for the different leave buckets. And when the time comes to submit for your quarterly payroll taxes, let's say your payroll taxes are $8,000, Social Security, Medicare taxes, federal income taxes, employer share of those. Let's assume it totals $8,000, and you've paid $5,000 of leave, either under the family medical leave component or the paid sick leave component to employees. That will simply be an amount of money that you will then be able to retain and not have to deposit for your payroll taxes. So it's sort of an immediate retention of amounts that would normally be deposited over as part of your payroll taxes. If your leave that you've granted employees is actually more than the payroll taxes you're going to pay for or deposit on a quarterly basis, you can ask for an immediate refund of that overage. So let's flip the tables a little bit. Let's say the amount that you're paying in quarterly payroll taxes is $5,000, but the amount you've paid out for family medical leave or paid sick leave is $8,000. You'll get to not only keep the $5,000, but you can apply for an immediate repayment of the additional $3,000. So what we're suggesting, if this is going to be applicable, because the question that we're getting is, well, how do I pay for this? How do I do it? Is you generally know what your quarterly payroll tax deposit's going to look like, and you can figure out now, essentially with the help of your accountant, your CPA, your business planner, how much that's going to be and how much you're going to be likely getting back if you provide leave to employees who ask for it. So while it's not going to happen until a quarterly basis, as a matter of financial planning, you do have some foresight into figuring out what that's going to look like. So David, go to the next slide. This is what we're recommending you do for each quarter. First, calculate your payroll tax liability. Then calculate the aggregate amount of qualified sick leave wages and qualified family wage leave wages that are going to be paid to the employee. And then calculate the maximum credit that's going to be allowed to pay that to all of your employees. So that's just a little step-by-step on how to go about calculating what that's going to look like if you have any employees that are able to take advantage of either of these two types of leave.
So one thing that we'll bring to your attention, we want to make sure we leave time at the end, but we didn't want to leave this out, is there is pending the CARES Act in Congress. If this is successful in getting through, what a lot of employers will have the option to do is to either seek loans to help offset costs, or there may be some additional benefits for employers in terms of what they can do with respect to their taxes. Unfortunately, this hasn't been resolved yet. I think that we're going to see that within the next few days, this probably will. It may have further implications for employers, so stay tuned for that. We may need to come back with a part 2 once we know what's going on with the CARES Act. But ultimately, the two big takeaways is that there is a possibility that if this goes through, employers, in fact, would be able to delay the payment of certain payroll taxes. And in addition to that, there would be loan opportunities available for employers to help offset the costs of keeping their workforce in place. What the government is trying to accomplish is to provide economic vehicles such that employers can continue to pay employees, even if the government is helping to back that. Obviously, that's preferential for mass layoffs and people converting over to unemployment and looking for other opportunities to pay their bills and cover expenses.
Is this me?
I think that's you, Jim.
Yeah, go ahead, David. This is just more on the CARES Act, so we can go ahead and go through this and get to the next slide.
Go ahead.
Yeah, you want to take that one?
Yeah. So outside of the federal legislation, Maryland has been, and I think that you saw yet again today, Maryland has been very, very proactive. The governor's administration is not one for sitting idly by and watching legislation not happen federally, and they have been at the forefront in terms of taking action. Governor Hogan's involved with the National League of Governors, and they've been very involved in trying to be proactive, in part because they're trying to reach out to the federal government to help offset some of the costs. The key takeaways here are, one, telehealth protocols have been significantly reduced both federally and in Maryland. In Maryland, what's really the takeaway here is that Maryland has suspended the need for people providing telehealth to be licensed Maryland providers. Ultimately, what they want to be able to happen is for people who need care to be able to seek that care without having to go to the hospital or without having to physically appear in a physician's office. So even on the federal, and we'll get to that in a little bit, even on the federal basis, there's been a relaxation in terms of where telehealth can be provided. So typically when you're providing telehealth, you're supposed to be in the same jurisdiction where the patient is. You're supposed to be providing it from inside a jurisdiction where you're licensed. That has now been relaxed in Maryland. The other takeaways from the Maryland law is that it prohibits employers from terminating employees solely because they've been isolated or quarantined relating to COVID-19. And then you'll see it provides some flexibility to the Secretary of Labor to allow workers who haven't been terminated to collect unemployment insurance. And you'll see, even though unemployment is not a key topic for today's conversation, it's obviously a big question. So let's jump into that. Before we get there, Jim and I don't want to focus on DC and Virginia components of the law. If you're an office that has or a practice that has an office or a location in DC and you have DC specific questions, we provide a little bit of information on that. We're certainly happy to field your questions on that if you want to send one of us an email or give us a call. But we don't want to spend time today talking about things outside of Maryland and Montgomery County.
So let's quickly talk about unemployment, because I actually get a fair number of questions from clients about unemployment, because the businesses are getting questions from their employees about whether or not they're going to qualify. And each of the jurisdictions has loosened up qualifications for unemployment. And at least as of the way the CARES Act is drafted right now, it appears that the federal government's going to assist or support the states in providing some additional funds for unemployment. The unemployment numbers are skyrocketing. So what kind of changes are being made? So for example, in Maryland, The Secretary of Labor has the statute that's been passed allows the Secretary of Labor to determine that an individual can be eligible for unemployment even if she hasn't been terminated. If her employer ceased operation because of COVID-19, the employee's been quarantined, or the employee ceased work because of a risk of exposure or infection, or to care for an infected family member. So you kind of see the theme that's running through all of this legislation now. The DLLR has put out helpful Q&As that make it clear that employees who have not been terminated but are unable to work because of the temporary closure or cessation of business may be eligible for unemployment, and the same applies for employees whose hours have been reduced. So rather than under the standard unemployment, obviously, you don't qualify if you are still employed. And these changes allow the employees to stay employed, and because of the reduction or cessation of the company's business, qualify for unemployment. At least in Maryland, the employees still must fill out the certificates that they're continuing to search for work. David, just go ahead and skip here. Maryland, interestingly, this is something that some businesses may be able to take advantage of, and we're certainly happy to help if this is help you work through it if this is something that may be of interest to you. It's not used very frequently. It is getting some attention now because of the economic circumstances. But Maryland has what's called a work sharing program, which an employer can apply for. And basically, if you take a group of employees and you're going to reduce the hours of that group completely pro rata across the board, those employees can then apply for unemployment insurance as a supplement to set off their reduced pay because of the reduced hours. Again, this program is almost never used at the Maryland Department of Labor Licensing and Regulation, but it is certainly an option if you have a particular group of employees and you're not going to lay them off, but rather you're going to reduce hours. If you reduce it in a pro rata amount and you apply to the DLLR to be part of this work sharing program, then the DLLR will allow your employees to be able to supplement that reduced work time and those reduced wages with unemployment, even though they are still employed. So the next two slides are DC and Virginia. DC and Virginia have both passed similar legislation. Just go ahead and go to the next slide if you can, David. So here's the bottom line for unemployment. Due to these changes in Maryland and other local DMV jurisdictions, an employee may be able to get unemployment benefits if they can't work because the business has temporarily ceased operations due to the coronavirus, or their hours have been substantially reduced. At least in Maryland and DC, it appears that they still have to apply for continue to at least certify they're continuing to look for a job. And in Virginia, the governor has excused claimants from that obligation. So you can basically tell your employees there may be options for unemployment if their hours are being reduced or if you're ceasing operations because of the COVID-19 virus.
Okay. Sorry for the jingling in the background. So what we want to do is we have a number of questions that we've received, and we want to outline the responses that we're getting for these questions. These are things that have been asked multiple times. What we'll do is we'll go through those, and it looks like we're doing pretty good on time here. So at the end, if you do have your own questions, we should have an opportunity to get to those as well.
Right. So particularly for Montgomery County, businesses, as many of you know, we have this earned sick and safe leave statute that provides employees with up to 56 hours of leave for a qualifying sick or safe leave reason. And all of these statutes start to weave together, and you got to figure out how they interact. So if we think about it this way, if you have an employee, well, first of all, unlike the new statutes in federal law, the Montgomery County Sick Leave Act does apply and is available to employees where an employer is closed and not operating because of a public health emergency. So I think that's an important, very important thing to note, because that's the big gap that exists under the Families First Act that was passed by Congress. So right now, if an employer ceases operations, which it appears that almost all employers in Maryland are going to have to under Governor Hogan's new order, an employee can apply to have their wages supplemented by exercising the right to take sick and safe leave under the Montgomery County statute. And again, that's up to 56 hours. And depending on how you've set up your policy, if you've allowed an employee to get that all up front at the beginning of the year, right now we're only into March, so it may well be available for a lot of employees. Some employers choose to do it on an accrual basis, and that is 1 hour for every 30 hours worked, up to 56 hours per year, or 32 hours if you're a very small employer with 5 or fewer employees. So if you've done it on an accrual basis, obviously the employees probably have not accrued their 56 hours. It's going to be something far less than that. But as long as they haven't used it, they will have it to use now if your business closes. Once that happens, an employee who may be out because they have childcare issues can then use the paid sick leave law under the Families First Act and get up to 10 days of paid leave that way. And then, well, at 2/3 rate. And then when that runs out, if they're caring for a child, they can move into the family medical leave. So someone who's out, at least in Montgomery County, may be entitled to various different types of leave as their status of remaining out of the workplace continues to go on.
Okay. Let me move forward. So there are a few questions, like I said, there are a few questions in here that we've wanted to include. There are questions that we've received. Most of the things that Jim and I are skipping over in the question section are either issues that have been addressed from the discussion above or are things that are not Maryland specific. But we wanted to leave them in the slide deck. Again, feel free to review them. If there are questions, you can certainly reach out to us. One of the common questions, and in fact, this has changed a little bit since this all started. Initially, our response to employers who were asking about, how they should handle employees who are either taking time off or are being furloughed. Initially the idea was that you still have to comply with whatever your written agreements and policies are with your employees. And the idea was that if paid leave was available, paid leave should be paid out. If sick leave was available, sick leave should be paid out. The federal law did clarify this issue and said that employers cannot require employees to use their other leave before the federal leave kicks in. So that means that if you have employees who are sitting on vacation time, or you have employees that have other types of sick leave involved, you cannot require them to take that leave before allowing them to participate in the leave provided under the new federal laws.
Right, but that'll kick in April 2nd. Right now,
as of April 2nd.
Yeah, right now it's still a little bit of the Wild West. I mean, as an employer, you have a number of options. You can require employees to use their PTO. You can allow them to keep their PTO and try to keep supplementing their income. You can have a couple options that we're going to talk about later. But just remember this requirement that employees cannot be required to use employer-provided leave before taking the Families First leave does not kick in until April 2nd.
Right, and that is a planning issue that employers are starting to look at, is that if there are these leave banks that are available, do we want to require employees to use them now if they're going out on leave before April 2nd? So some employers are trying to make decisions about that. I think everybody would like for the CARE Act to be completed so they know what kind of financial backing there is available to the employers before they make these difficult decisions. But as anybody who's had anything planned for last week and this week and going into next month, as anybody knows, planning these days is very, very challenging. So I think this touches on what we were just talking about. For businesses that close before April 2nd, obviously any contractual benefits or policy-based benefits that you have in place with your employees, those will be available to employees and those will kick in accordance with the plans. One of the items that we noted to people early on was that if you have a provision in your employment agreement or in your policies that say employees must give 2 weeks notice before termination, and you're considering terminating employees, keep in mind that you may be obligated to pay those 2 weeks out now. So that's certainly a big financial consideration for employers to look at.
Okay. So we fielded a number of questions about reducing salaries. And when it comes to reducing salaries, there are a couple important items to keep in mind. First, you have a difference in your workforce between your non-exempt employees and your exempt employees. The non-exempt employees, as we all know, are employees who are required to be paid minimum wage and entitled to overtime paid. Typically, they're paid on an hourly basis, although they can be paid on a salary basis as well. Your exempt employees are the employees that are not entitled to overtime because they're being paid at a certain salary level and they have exempt duties. With respect to reducing salaries for exempt workers, under the Fair Labor Standards Act, the Department of Labor typically takes a dim view of employers that move a salary up and down for a particular employee because they take the position that you're really paying an employee based on either quantity of work if you're doing that, and that is illegal. For an employee to be exempt, they must be paid a standard or the same salary regardless of the quality or quantity of work they're doing. So reducing a salary for an exempt worker can be tricky, but the statute does allow an occasional reduction of salary. It allows an employer to reduce salary, for example, when there are difficult economic times. So the short answer to this question is yes. As a business, you can decide to reduce the salary for exempt workers. Say someone who's making $70,000, you want to reduce their salary at this time to $40,000 or $50,000. You may even want to provide them some relief so that they don't have to work the same number of hours. But that's not absolutely critical. Even though you reduce their salary, you can require them to work the same or even more hours. But you just have to be careful. And then in Maryland, there's a little nuance. Under the Maryland Wage Payment Collection Law, a company is required to give an employee at least 2 weeks notice of any change in salary. So if you're thinking about reducing the salary for an exempt worker, you'll want to take that action as soon as possible because you will have to give the employee 2 weeks notice to do that. Can my non-exempt employees receive unemployment insurance if they're transitioned from full to part-time work? Again, going back to some of the changes in the unemployment insurance laws, the answer to that would be probably yes. Okay, is this mine, David? Okay, this is still mine.
Oh,
so exempt employees during closures, even if furloughed, exempt employees must receive salaries if they do not, if they do any work. Again, this goes back to my distinction between non-exempt and exempt employees. Non-exempts are pretty easy. They don't work, you don't have to pay them. Exempt employees, if they perform any work during a work week, they're entitled to their their entire salary for that work week. So when you get into situations with exempt employees in either remote work or telework, if they're going to be doing any type of work, checking email, responding to questions, responding to emails, responding to texts, if they're doing any kind of work for the business during a work week, they're entitled to be paid. If they have PTO, that can be used as a substitute. So if someone has works for 2 days and they take 3 days off, or you put them on furlough for 3 days, you can use the PTO to supplement that and pay them the salary for an entire week. On the other hand, if you are going to furlough employees permanently, exempt employees permanently, as long as they aren't performing any work during the work week, then you do not have to pay them for that work week. Non-exempt employees during closures, again, if non-exempt employees aren't working, you don't have to pay them.
You want to touch on the WARN Act? I think just to say that, there are certain requirements for employers in Maryland that have in excess of 100 employees. So if that's an issue for you, before you make decisions, you certainly should be reaching out to your counsel. If you have a question, you can certainly reach out to us. So as we noted above, the rules governing telehealth have been relaxed significantly. The primary changes on the federal side are similar in that it allows for seeing out-of-state patients. There also is a significant relaxing on where the services can be provided from. For those of you who engage in telehealth, you know that there are fairly strict rules in terms of where the patient has to be, where you have to be. So now they are relaxing the rules around this, really in an effort to allow for people to engage in healthcare, meaningful healthcare, without necessarily having to go to a physical doctor's office. And in doing this, CMS has established different codes to allow for full reimbursement regardless to the point of service. So if you're engaged in telehealth, it's certainly worthwhile to speak with your coding people about making sure that you're using the proper up-to-date codes and making sure that you're getting full reimbursement for your visits. Can employers refuse in-person appointments with certain patients for protection of staff? So generally speaking, this has been a fairly hot topic. Obviously, our employees that are working in the office are expected to perform their duties. If there is a risk that is covered from one of the categories above, then I think that you'll see that employees probably are not going to be coming to work. They're either going to be home caring for children, they're going to be home because they've been advised by a healthcare provider to self-quarantine, or they're going to be seeking care or diagnosis of COVID-19. For employees who are at work, they are expected to do their job. Simply having a fear of contracting the virus is not in and of itself a reason for going out on paid leave. Obviously, what we're seeing from most of our providers are having discussions with patients before they come to the office. Patients who are coming that have any signs or any of the symptoms of COVID-19, what we're finding most of our clients are doing is they're usually asking those people not to come into the waiting rooms. They're usually asking them to call from their car when they're there. Usually someone is going out and meeting them with a mask, and they're bringing them into the office either through a side door, or they're marshaling them back into an office or an exam room that's been designated for seeing patients and is getting extra cleaning, even though most of our providers are now providing extensive cleaning services in their office. And over the last week in particular, we're seeing a lot of providers that didn't normally engage in telehealth working towards telehealth if possible. All right, Jim.
Yeah, this is just piggybacking on what you said, David. Can an employee refuse to work because they're concerned about contracting the virus? The short answer to that is that at this stage, there aren't really any basis for an employee to work simply because they're worried about contracting the virus. The Occupational Safety and Health Act certainly provides workers protection from if they are in imminent danger, which typically means death or serious physical harm. And at this moment, the work conditions, even with the COVID virus, are not putting workers in, at least according to OSHA at this point in time, it's not considered to be an imminent danger situation that would allow an employee to just simply refuse to come to work.
Yeah, and I think Jim has an important note at the bottom of the page here. We have found most of our employers are working in a very difficult balancing act right now, trying to make sure that they're still engaging in business, trying to make sure that they're still seeing, for example, their patients, but they're also trying to be sensitive to the needs of their employees. So as Jim noted on the slide, if you have an employee who has an anxiety or an issue that is related to this, there are a lot of employers are allowing them to use unscheduled leave and to use up the leave that they have accrued.
Yeah, David, I think that's right. At this point, our experience at this point, and this is based on numerous calls I've had with various businesses across various industries over the last probably week and a half to 2 weeks, is that most employers are at this point taking this in what I would call kind of 2-week bites. Over the last week, a lot of employers have tried to decide to gut it out, for lack of a better word, to continue to pay employees, not to lay people off, not to substantially reduce salaries, not to substantially reduce hours and reduce income. But obviously all that is changing as the news comes out and the updates come out that this may be obviously an extended situation. And now with Governor Hogan closing businesses, I think that that's probably going to continue for at least several more weeks as well. So I think that the tide is going to be changing, that employers are going to be making very, very tough decisions about layoffs and furloughs and what their obligations are going to be, particularly come April 2nd. Obviously, most schools, all schools, at least in the state of Maryland, are out. Most daycare centers have shut down. So many of those individuals who are out of work because they have to stay home and take care of their children are going to be able to rely on some of the leave we've talked about, both the Montgomery County Earned Sick and Safe Leave, the federal paid sick leave, and then the expanded family medical leave.
So, Carissa, that is the stock questions, and I see that there are some good questions already queuing up in the chat box. I don't know if you want me to turn that over to you to manage the chat box.
Sure. And we have a few questions that have been sent to us in advance via email as well. So I'll probably start in with those. I do want to respond to just one question that we've already gotten, which is about getting a copy of the slide deck. Yes, we will send out a PDF of the slide deck after this so that you can refer back specifically to different sections of it if you'd like to. So our first question.
Chris, if I can chime in just a second here.
Sure.
Our firm, and particularly the Employment Law Group, has already put up about a half a dozen blogs on all type of issues. We generally get those out immediately to an email list that we have, and we also have a digest ready to go out that digests all of those and provides links to everything that we've put up so far. So if someone is not on that list but wants to be put on that list, Chrissy, you want to have them send you an email and you can forward it to me, or you can forward it directly to me or David using the email address that's on the last slide. But we are working very hard to bring clients the latest updates and the latest news, and feel free to let us know if you'd like to be on that email list.
Yes, we'll make sure we provide everyone with an opportunity to opt in response to their post-event email, and connect them with you. Okay, so we're going to go ahead and move to the first question that we've received. So this practice says that payroll is their biggest expense, that they're a surgical practice, and that the salary of a single associate is the largest item on the payroll. They are not currently doing any surgeries or routine patient visits at this time, so their revenue has dropped significantly. So they're asking what their options are to manage that, if the associate's salary could be reduced, if they can be laid off, and what sort of notice would be required, can they be furloughed, and if they can rehire them at a reduced salary to do lower revenue work such as telehealth visits.
Jim, that piggybacks with the slide that you had mentioned earlier. Do you want to take that?
So I assume by associates, we mean physicians?
Yes.
Okay.
I assume we're talking about a non-stockholder physician employee.
Right. Obviously, one of the first things you want to look at is there an employment agreement in place? Many, even non-stockholder associates may have physician employment agreements, and that's the first place to look and determine what the options are. But let's say an agreement does not exist. At least at this point in time, as a practice, you have a fair amount of flexibility. You can furlough that associate completely, so that they're no longer performing any work. And if that's the case, then they do not have to be paid on the salary basis. And you can reduce their salary as well, and have them do, I guess, some other type of work that you were referring to. So there are a lot of options with associates. The key thing is that if they're doing any work, they must be paid on a salary basis. That can be a reduced salary basis, but they do have to be paid. If they have any PTO available for days that they are not working and that you do not want to pay them salary, you can ask them to use their paid time off as a supplement until that runs out. But yeah, full furlough, that's fine. Reduced hours along with reduced salary, that's fine. What you can't do is have them essentially volunteer or do any kind of work if they're not being paid.
And I want to stress for everybody that I agree with Jim, but don't forget his initial comment was, if there is a written employment agreement in place, you must check that. Termination provisions in employment agreements of this nature do not typically include force majeure, act of God type issues. So if you have an employment agreement in place, reach out to your counsel, reach out to us, sit down and study what those termination provisions are before you breach the agreement. Right.
Our experience is that physician type employment agreements will often have a variety of ways that they can be terminated, and typically there's usually a termination provision without clause, whether it's 60 days or 90 days or 30 days. That's going to be the critical place to look. And depending on the circumstances, you're going to have to evaluate whether or not you want to go ahead and consider triggering that 30-day or 60-day notice provision. Maybe you want to suggest to the associate that you're going to trigger it, but you're willing to continue employment under different circumstances. So that's something you'll definitely want to discuss with counsel.
All right, so our next question asks, do you have any information on governmental interest in helping employers who want to continue to pay health care plan premiums for employees who have been furloughed?
The short answer to that is no. We have to see what's going to be in the CARES Act. What I haven't seen, at least as of right now, well, I shouldn't say that. There in an earlier version of the CARES Act, and I haven't seen what was passed or what was currently on the negotiating table last night, but under an earlier version, there was some indication that there was going to be financial help for employers who continued to pay the employees' health insurance. Currently, that is not addressed by the Families First Act or any other state or local legislation. So I think the answer to that one is hopefully that will be included in the CARES Act, but we have to wait and see what's passed.
And our assumption is, based on what we've seen, that that would come by way of, yet again, a tax credit, which means that the employer would have to initially foot the bill and then seek the tax credit. Hopefully, the CARES Act is going to balance that out with some of the loan opportunities that are there.
Right.
Okay, so this next question comes from Practice, which is primarily based out of Virginia. And they're asking, with regards to stating a qualifying reason for leave, if an employee is experiencing COVID-19 symptoms and seeking a medical diagnosis or experiencing any other substantially similar condition specified by the HHS in consultation with the Secretaries of Labor and Secretary, what protection does an employer have to require for proof from that employee? So if they don't have a specific note from their physician, what proof can an employer request from that employee?
So I don't know if there is Virginia-specific legislation on this. I'd have to look back through the Virginia-specific component. But certainly under
Nothing in Virginia right now.
that's, and I don't think that has changed. But certainly under the federal act that is in place, that if an employee is out because they believe that they have symptoms and they are seeking diagnosis, or they've already consulted with somebody and they are self-quarantining because they've been advised to do so, they would fall within the purview of the federal act, which again, as Jim noted, becomes effective as of April 2nd. So you want to be mindful of the timelines that are in play here.
Okay. So the next question asked, if an employee has a child and is pregnant due sometime in the summer, would she be able to use both EFMLEA for her first child and then FMLA when she has her baby?
Short answer would be yes.
Right.
Yep.
They're stacked. The reality is that leave taken under the new federal component of the FMLA would probably be exhausted before the summer, but the benefits would stack.
Okay. And what is an employer's responsibility if one of their employees is quarantined for COVID-19 to ask other employees to maintain their regular schedules? Are they no longer able to maintain a safe workplace, or would they be considered to be putting their employees at risk if they require employees to come in even after one of the employees in their workplace has been diagnosed?
So this is probably a question that one of the attendees may be able to answer better than Jim and myself can.
Yeah, there's very specific CDC guidance on both of these issues. On the issue of someone who was potentially exposed to someone with the virus, as well as CDC guidelines with respect to an employee who actually is diagnosed to have the virus. With respect to someone who has been potentially exposed to someone with the virus, the CDC guidelines do not say particularly that there has to be or should be a notification to other employees, but that employee should certainly be asked to self-quarantine or self-isolate. If someone actually has the virus, the ADA prevents publishing that person's name, but certainly CDC guidelines require or recommend that all employees in the workplace who may have been exposed to that employee are notified immediately, and that steps are taken to either clean, sanitize, or disinfect the workplace where that employee has been, so that, depending on the circumstance, may require that the business be closed down. But I would recommend you look at the specific CDC guidelines, because it does address both of those issues with really good, clear guidance.
All right, so the next question, I know there is an extent to which it was covered in the Q&A portion that you went over, but maybe you can expand a little more. If an employee has PTO that can be used for the 2 weeks during a business's closure, will the employee still be eligible for unemployment during that time?
The answer to that would be yes. They could, under the more liberal rules that the states have put in place, the employee could certainly apply for unemployment. How much employment they get will depend on how much PTO they're using.
Okay, so this next question is directed to David. You mentioned that we are going to be restricted to home confinement as of 5 p.m. We are doctors coming into the office, but we're not seeing patients at the same time that we're answering calls and we're providing telemedicine information. Does this mean that my employees and I will continue to be able to come into the office to help avoid the ERs being jammed?
So I want to clarify first that we are not being restricted to home confinement. The governor was very clear in his remarks earlier today that they want all non-essential businesses in Maryland to close as of 5 p.m. today. There are federal guidelines that were issued, I believe, last Thursday, which covers what is essential and unessential businesses. And if I can find a link to that, I'll send that over to you, Carissa, and you can circulate that to people. But the governor wanted to be very clear that at this point in time, as long as people begin to behave a little bit better than they have been, which means not flooding down to the cherry blossoms and not flooding down to public parks and things like that, the things that we see people doing on Twitter and we comment to one another about are the things the governor doesn't want us doing here. But in terms of healthcare providers going to work, I think that right now it is anticipated that most healthcare providers are going to continue to work. The part that I am not clear about, and we'll try to get more guidance to you on, is whether there has been a distinction drawn between essential and non-essential healthcare. I think that the idea is that if you are in a purely elective-based practice, then there is an expectation that you won't be seeing patients and you won't be working. If you are providing coverage by way of diagnosis, treatment, care, particularly of individuals who could be impacted, I think that there is an expectation that you are essential. But again, we'll try to get you further guidance that you can circulate out to your members.
Okay, great. So we've got someone asking what the start date for the paid sick leave policy that you mentioned is. Is it also April the 2nd?
So the answer is that the changes to the paid sick leave that came through the federal legislation, those changes are effective as of April 2nd. Of course, in Maryland and Montgomery County, there is already existing sick and safe leave laws. So if you need additional information from that, you can check on our website and get a number of publications on that. But general sick and safe is already in place in Maryland, but the expansion from the federal legislation would be effective as of April 2nd.
Okay. Our next question asks, do you need to give 2 weeks notice to furlough employees?
Short answer is no.
Okay.
No, the only time, the only restriction on layoffs or mass furloughs or layoffs like that would be for a business that is large enough that it's covered by the WARN Act, which is a federal law, and it applies to businesses with 100 or more employees, excluding part-time employees. So if a company is large enough to come underneath the WARN Act, certainly should seek advice from counsel before any mass layoff or furlough, because at least as of now, the 60-day notice requirement under the WARN Act is still in place. And I'm not sure that the CARES Act deals with that particular issue.
Are healthcare practices who have had to reduce staff due to financial reasons as a result of 75 to 80% reduction in patient appointments required to pay the furloughed employees their earned time off if the only agreement they have in place is that upon termination, the employee will be paid out at the rate of 75% if they complete their 2 weeks notice?
Yeah, good question. The answer to that is no. The PTO that has been accrued and earned, you can allow them to use it if they want. You can require that they take it as to supplement time off. You can have them keep it in abeyance if this thing continues to slog on, and employees are going to need it for later. If your policy says that you will pay it out upon termination of employment, or any portion of it to be paid out upon termination of employment, that will trigger the obligation to do it. So if you decide to terminate the employee, or the employee decides to terminate their own employment under these circumstances, yes, that will trigger the requirement that you pay it out if that's what your policy says. In Maryland, the DLLR lets employers have a fair bit of leeway in this circumstance. Employers can have a use it or lose it policy. They can have a policy that no PTO is paid out at the time of employment, at the time of termination of employment, or you can have a policy that pays all or some of it out. The bottom line is you have to follow that policy.
All right, and then our final question from the chat is a follow-up to the question about continuing to offer insurance to employees. If no government assistance arrives to help cover insurance premiums paid by employers, can employers terminate that benefit to employees? Is advance notice needed, and is COBRA going to be available to those employees?
COBRA will be available to many employees who lose their jobs, obviously, or have a significant reduction in their work hours. Whether or not, I think the biggest question we get is, can we continue the health benefits for an employee even though the employee's been terminated, or significantly had their hours reduced or furloughed? And that's a difficult question because most health insurance plans cover eligible employees. Eligible employees are employees who are working typically a certain number of hours, say 30 hours, or who are, quote, active employees. So if employees are furloughed, technically they no longer become active employees, and that would trigger COBRA, and you could probably not be able to keep those employees on the health plan and pay for those employees' premiums. We're hoping that the CARES Act will deal with some of those issues so that employees can continue to get, obviously, vital health insurance and health care. But right now, we have to look to our plans and to see what the health benefit plan for your particular business provides. And typically, it only applies, employees are only eligible if they are, quote, active or working a certain number of hours. And if that's no longer the case, then COBRA is going to kick in.
So this practice has closed for now, but they do have an employee who is at home with their child, whose school is closed right now, and she does have PTO available. So they're wondering if she is still eligible for FMLA.
the new FMLA, the Emergency Family Medical Leave Expansion Act, doesn't kick into April 2nd, so that would not apply. The normal FMLA doesn't apply to this type of situation. So the answer is, at this point, is that there is no legislation that would protect that leave or provide a leave, an obligation of the employer to continue to pay her at the 2/3 rate as of now. Come April 2nd, that would change. Come April 2nd, that particular employee would be able to continue to be paid at 2/3 the regular rate of pay for the first 10 days under the paid sick leave law, and then to be able to continue that for another 10 weeks under the expanded Family Medical Leave Act. But as of now, that employee basically can use his or her PTO if the practice wants to allow it. That's probably the best way to get the employee to continue to be paid during this period of time.
Okay, so I'd like to remind everybody who's on the phone right now that if you press *6, you can unmute yourself and ask a question if you'd like to. And for those who have expressed further concern about whether or not their practice would be considered or their specialty would be considered essential, we will be sending out additional information about that after the call, because obviously it's going to vary by specialty, and we want to make sure that we're sending out complete information to all of you. And then thank you also to those who have gone ahead and subscribed to Paley Rothman's newsletter. I will make sure to get that information over to them after the call. Do we have a question from the phone?
Yes, I had a question. Maybe you could send this in your next written communication, but what's the difference between an exempt and non-exempt employee?
Sure. I mean, I can give you the high level answer to that. An exempt, well, let me take an exempt employee first. For an employee to be exempt, there's a two-part test. First, the employee has to be paid on what's called a salary basis. In other words, they have to be paid the same amount every pay period, regardless of the quality or quantity of work. So we typically think of that as a salaried employee. In addition, that employee has to be performing work that is considered to be exempt. In other words, they have to have a sufficiently high level of responsibility, duties and responsibilities under certain criteria that the Fair Labor Standards Act, the Department of Labor, has put out. We think of those employees as white-collar exemptions, which means they are administrative, professional, or executive in nature. An administrative employee is someone who has significant decision-making responsibilities for the business. So it's not someone like a receptionist or an administrative assistant or someone like that. An executive employee has to also have significant decision-making responsibilities and must have the power to hire, fire, or make significant employment decisions for at least 2 or more employees. And then the professionals are folks that you would typically think of, doctors, lawyers, engineers, accountants, those particular people. So to be exempt and to not have to be paid overtime for all the hours you work in a week, you have to meet that two-part test under the Fair Labor Standards Act, i.e. be paid a sufficient salary that's not based on quality or quantity of work, and be performing a certain level of duties that fit under the white collar or other exemptions of the Fair Labor Standards Act. Everyone else is really non-exempt, and those employees are entitled to be paid time and a half for all hours worked over 40 hours in a week. Basically, there's a whole lot more to it, but those are the basic differences between an exempt and a non-exempt employee. The non-exempt is entitled to overtime and must be paid a minimum wage. The exempt employee does not get overtime, but they must meet the salary basis test and the duties test in order to qualify for that exemption.
And what about production bonuses? Does that make an employee who is professional remain in the exempt category if
Yeah,
they're
you
getting
can
paid?
yes, you can have bonuses for exempt employees. That's not a problem. Bonuses for non-exempt employees becomes a little tricky because those bonuses have to be factored into their regular rate of pay. So for example, if a non-exempt employee works 50 hours one week and in that same week you give them some kind of bonus, then that bonus is added to their pay for the week, and you have to recalculate the regular rate of pay. It actually goes up, and then you have to pay them time and a half on that increased amount. But production bonuses and those kinds of things for exempt employees, it's not a problem. It does not impact their exempt status.
Thank you.
All right, so we'll go ahead and we will close this session for now to be sensitive to everyone's time. So I just want to thank you all for joining us, and thank you to both of our speakers, James Hammerschmidt and David Shapiro from Paley Rothman. Their expertise has been invaluable to us. We will be making this webinar available online through our YouTube channel. So don't forget to subscribe to that. We'll send out the link after this session. It will include a link also to our recent telemedicine webinar if you have an interest in that from last Thursday. A few other items I want to make you aware of. The first is that MedChi, the Maryland State Medical Society, does have dial-in information for the weekly calls that Howard Haft from the Maryland Department of Health is hosting for primary care practices as relates to COVID-19. So if you're interested in receiving that dial-in information, please let us know, or you can visit medchi.org. They have a COVID-19 information center, and you can get the information there as well. Our next webinar in this series will be held tomorrow, Tuesday, March 24th, and it will address rapid implementation of remote patient monitoring. So if your practice is interested in that area of telehealth to stabilize your cash flow, that may be helpful to you. And then finally, we did launch a new Facebook group for physicians last week. It is physicians only. We are validating everyone. So if you'd like a physicians only space to talk about what your practice is experiencing during this time, or maybe even to get away from all of the COVID-19 talk, that is there for you. So we'll also include information about how to join that group. And so with that, I'll go ahead and let you all go. Again, thank you so much for participating, and we'll get those additional resources out to you just as soon as we possibly can.
Thank
Have a
you.
good afternoon.
Thanks, Carissa.